Throughout history, deadly pandemics have shaped the course of human civilization. From the terrifying Black Death that wiped out a third of Europe, to the rapid spread of COVID-19 that brought the modern world to a standstill, these pandemics have left a lasting mark on society. In this video, we'll explore 4 of the most devastating diseases in history: plague, smallpox, the Spanish flu, and COVID-19, revealing how they reshaped economies, governments, and even the way we live today. A plague epidemic. Plague, also known as Black Death, is a disease caused by bacteria, which has repeatedly devastated the world throughout history. Caused by the Yersinia pestis bacteria, plague primarily spreads through live fleas parasitic on rats, but can also be transmitted through other routes. Plague has affected humans for centuries and still exists today, although it is relatively rare in most parts of the world. Archaeologists have found evidence of plague presence in bone remains dating back to the Neolithic period. The Justinian plague began in the Mediterranean in 541 AD during the reign of Emperor Justinian and lasted for about 200 years. It is believed to be a major plague pandemic. In history, it is believed that the Justinian plague was one of the causes of the fall of the Roman Empire. However, although this epidemic caused significant damage, killing thousands of people and forcing authorities to intervene in handling the bodies, modern research has debunked most of this hypothesis. The most famous bubonic plague outbreak occurred during the Middle Ages. After claiming the lives of millions of people in Asia, the disease reached Sicily through sailors who had been to the Far East. After spreading throughout Italy in 1347, the disease quickly spread to the rest of Europe in the following years, with sporadic outbreaks over the next 4 years. It became known as the Black Death, killing over 1/3 of Europe's population, estimated at around 25 million people. The pandemic has completely changed the economic and social landscape of Europe, with a severe shortage of labor, especially skilled craftsmen. Crimes against Jews have increased dramatically, with some blaming them for causing the disease by poisoning water sources or spreading toxic gases. At least 235 Jewish communities have suffered brutal oppression during the Black Death in medieval Europe. The significant population decline has meant that some communities have had to rebuild from scratch. The power structure in Europe has also changed, with Italy, once the most powerful nation, losing its economic and political position after losing 2/3 of its population. Today, plague outbreaks are often found in rodent species such as ground squirrels, prairie dogs, pocket gophers, and sewer rats. Although there are now antibiotics to effectively treat infection, there are still cases of death from the plague. Madagascar, Congo, and Peru are currently considered countries with the highest rates of the disease. Bubonic plague can still cause economic disruptions. For example, in 2006, over 150 workers at a diamond mine in Congo were infected with the plague, forcing mining operations to temporarily halt. Currently, the majority of human cases of the disease in the United States occur on the West Coast and in the states of New Mexico, Colorado, and Arizona. Symptoms of the disease include fever, headache, chills, and swollen lymph nodes, also known as buboes. This is also the origin of the name plague. Smallpox. Smallpox is known to be the cause of death for a significant portion of the indigenous population in the Americas after being introduced by European explorers and colonizers. Its impact has even spread to many other regions around the world. Smallpox is believed to have existed for over 3,000 years, and currently, the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, have declared it eliminated globally. The initial symptoms of smallpox include high fever, back pain, and fatigue. A few days later, the patient will develop rash-like spots on the skin, starting from the face and hands, with pus-filled blisters. Eventually, this pus dries up, forming scales and peeling skin. Approximately 30% of smallpox patients die, and those who survive often carry large scars. Along with influenza and other diseases from Europe, smallpox contributed to a decrease of about 95% of the indigenous population in the Americas within a few decades after the arrival of Europeans. The indigenous people did not have immunity to these unfamiliar diseases, and they quickly spread within communities that were unaware of germ theory, immunity, or disease prevention measures. Although Europeans did not intentionally spread smallpox, it still caused devastating consequences. In 1763, when the French and Indian War ended, the first recorded case of intentional biological warfare occurred in America. In an effort to suppress the uprising led by Pontiac, the British Army distributed blankets infected with smallpox to the Shawnee and Delaware tribes during negotiations. Smallpox was the first disease successfully vaccinated against in 1796. The last naturally occurring case of smallpox was recorded in Somalia in 1977. However, the dengue virus is still preserved in some laboratories for research and vaccine development in case of a resurgence or to counter threats from biological terrorism and biological warfare. Spanish flu. During the final stages of World War I, 1918, many countries, including the United States and several European nations, tightly controlled the information published in the media due to the ongoing war. Spain, however, was a neutral country and not bound by these restrictions, and it reported widely and truthfully on a global influenza pandemic. As a result, this disease became widely known as the Spanish flu. In addition, it was also called by many other names by soldiers and communities around the world, such as the Purple Death, Flanders fever, or sandfly fever. Although named after Spain, it is believed that this disease actually originated in the United States and was brought to Europe by soldiers stationed at Camp Funston, Kansas, during their deployment in World War I. From there, the disease spread rapidly. Initially, this disease appeared to be a common flu, causing discomfort for some individuals, but not considered a serious threat to public health. However, when it resurfaced in the autumn of 1918, it attacked with terrifying intensity. By the end of the pandemic, it had claimed the lives of approximately 50 million people worldwide. This flu virus started with symptoms similar to a common flu: sore throat, cough, and chills. But within a few days, it began to aggressively attack the lungs, leading to severe respiratory distress, causing the lungs to be congested with fluid and ultimately resulting in death. Patients in severe stages would turn blue, usually starting from the feet, a sign of oxygen deprivation in the blood. This is why it was called the Purple Death. The most frightening aspect of this disease was that it could attack anyone, not just the elderly, weak, children, or those with weak immune systems. Even young and healthy soldiers could fall ill and be hospitalized within a few days, or even hours. It seemed that no one could escape the onslaught of this dangerous virus. Scientists made efforts to develop a vaccine against this dangerous virus as it spread like a storm in both rural and urban areas worldwide. Even remote and isolated areas are not immune to the epidemic. Islands have been attacked by the virus, and some villages in Alaska have been completely wiped out. Life in many places has come to a standstill, with businesses and schools closed, some voluntarily, and others by government order. People are advised to wear masks, and in some areas, the police are instructed to arrest anyone coughing or sneezing in public. Many families are facing compounded difficulties due to food shortages and loss of primary income caused by the pandemic. The healthcare system is also under immense pressure, with many doctors and nurses being deployed to the front lines to serve in makeshift hospitals, further depleting medical resources in the rear. Many healthcare workers have also contracted the disease while caring for patients, adding to the urgency in the search for a vaccine, and pharmaceutical companies have been working day and night to find a solution. However, before the virus antigen could be isolated, the pandemic seemed to mysteriously disappear as it appeared, leaving behind the consequence of over 50 million deaths worldwide. COVID-19. The new coronavirus in humans in 2019, commonly known as COVID-19, or simply COVID, remains a horrifying memory in the minds of many people. However, due to the rapid spread of information on public media and social networks, there is a lot of misinformation about this disease and its biological characteristics. True to its name, this disease was first discovered in 2019 in the city of Wuhan, China. With initial symptoms similar to pneumonia, this disease did not respond to conventional treatment methods. Doctors and virologists quickly realized that this was a new pathogen, and the world began to react as it spread at an alarming rate. The first confirmed case outside of China occurred in Thailand in early January 2020. Since then, the virus has quickly appeared in many other countries, including the United States at the end of that month. In the face of the COVID-19 pandemic, many countries have declared a state of emergency. As of the end of September 2020, there have been 1 million deaths worldwide due to COVID-19. Strict measures such as lockdowns, quarantine, and social distancing have been implemented in many cities and countries around the world to control the pandemic, causing much controversy in society and political conflicts. The first COVID-19 vaccine was introduced in December 2020. However, like many other viruses, the causative agent of COVID-19 has the ability to mutate. Many new variants have emerged and spread in the community since the outbreak. Although vaccines have been adjusted to cope with the new variants, COVID-19 remains a global health threat to this day. The COVID-19 pandemic has changed the way people interact with each other worldwide. Automation has been accelerated globally to minimize the risk of virus transmission. Political divisions have reached their peak during the pandemic, causing global distrust among people. There are various estimates of the death toll. The World Health Organization, WHO, estimates that about 6.5 million people have died from COVID-19 as of the end of 2022. WHO estimates that the actual number could be nearly 3 times higher, around 15 million people, in the first 2 years of the pandemic. Meanwhile, some sources estimate that the number of deaths from COVID-19 could reach 20 million.